when you are building a product in the healthcare space, you should build with facts that clinicians are in your team, lawyers and legal teams with compliance team. All those personnel should be on your team. Then your technical team and your marketing team. So if all of these can be able to work in sync, right, you would see that both privacy of the patient safety, and all of that is properly taken care of.
Welcome back to Just Africa on SOUQ News Television. Do well to follow us on all our social media platforms at SOUQ News Television and subscribe to our YouTube channel at Just Africa Show. Across Africa, healthcare systems continue to face deep structural gaps, from limited resources and workforce shortages to inefficient service delivery and unequal access to care. While technology promises solutions, many digital health tools fail because they are designed without the realities of frontline healthcare in mind. This episode of Just Africa focuses on the human side of health tech, how empathy, clinical experience, and thoughtful product design can transform healthcare delivery across the continent. Joining us virtually on this episode is Dorothy Lameed. She is a nurse, a product manager and health tech innovator whose work sits at the intersection of clinical care and digital health solutions. Dorothy brings a rare and powerful combination of frontline healthcare experience and product development expertise. She has worked on electronic health records, telemedicine platforms, and patient monitoring tools, transplanting real clinical pain points into scalable, ethical, and user-centered digital solutions. Her work challenges a common flaw in healthcare innovation, which is building technology without listening to the people who use it daily. Welcome to Just Africa, Dorothy.
Thank you so much. Thanks for having me.
I wanted to reel out all your accolades so that everybody that is listening will know you are talking to an expert.
All right, thank you so much. Yeah.
All right, Dorothy, let's focus on the healthcare gaps that we've noticed. Let's even try to understand it first. From your perspective, what are the most critical gaps in Africa's healthcare system that we're experiencing today?
Okay, based on my experience, like you mentioned, I think the most critical gaps I've been able to identify are like three major ones, right? Talking about funding, human resource, and infrastructure. Now, every day, clinicians have to manage high patient volumes. They have to manage documentation. And they have to also deal with the fact that they make critical decisions, right, in short time frame with limited support. So these three gaps, they are not independent of each other. That is funding, human resource, and infrastructure. They're actually not independent of each other. They create a very compound problem. But using health tech, right, if we are able to address these three major problems, I believe that healthcare outcomes will be way better.
Okay, I mean, there are so many terminologies or things that they're healthcare jargons. What do you mean by healthcare technology?
Okay, healthcare technology is quite simple. Now, I'll just use the most layman language I could possibly come up with.
Okay.
It's basically using technology to solve healthcare problems. It varies, right? You could have, like you mentioned, telemedicine earlier.
Yeah.
So what a typical telemedicine platform would look like is basically connecting you directly to care, either through AI, like we are currently experiencing, or connect you directly to a doctor, right? Without having to pass through the stress of entering transport to the hospital, queuing to see the doctor. Then after queuing, then you now be sent from one department to another to carry out another test, make payments, and all of that. So I think for telemedicine, it's able to cover that. If you're looking at the EHR system, we are reducing the problem of fragmented data that's under infrastructural problems, right? So instead of having data that is, okay, this hospital has this information about you, the other hospital has another information about you. If I let's even leave different hospitals, let's talk about the same hospital. There are times where patients will be sent from, let's say, radiology to go to the doctor's office in family clinic, and then there's no documentation of what was discussed in radiology, or there was no documentation of what was discussed in the emergency unit in the system. So I
Yeah.
think technology has been able to make sure that all these gaps are filled, all these gaps are taken care of, and patients' outcome is way more better, and clinicians' overburden is severely reduced.
It's really great that you even explained it, because at first when I was thinking technology, I was like, are we going beyond stethoscopes and syringes? Because that's all we, when we see those two, we know this person is a doctor or this person is a nurse. So now we're imputing AI and other technologies to help us solve healthcare problems. Is that what it is?
Yes.
Ah, okay,
So
that's simply
that
put.
is the current state. Yeah. Yeah.
Okay, so I want to ask, at what point in your career, you being a nurse, at what point did you realize that yes, it's high time we brought in technology in solving problems? Now, we're not just talking about clinical skills, we're talking about the technology you mentioned now. At what point?
For me, I would say I've always loved technology, right? So it was, I know that it sounds cheesy, but it was always from the very beginning. So during my time in like clinical posting, I noticed that as a person, I don't really like the whole bedside nursing kind of day-to-day activities. I love the fact that I can stay from the comfort of my home and still deliver good care without having to go through the stress of, going to the hospital every day, changing bedpans and all of those things
Yeah,
that a typical
yeah.
nurse is doing, taking vital signs and all of those things. So
Okay.
for me, I believe it's from the very beginning, right? Based on my time in school, after like the first clinical posting that it's compulsory for every nursing student to take, right?
Okay.
So it was from that very first posting that I was able to be like, okay, I have to find a way to actually deliver care
Yes.
without being on the bedside. Although you cannot overemphasize the importance of bedside experience because
Yes.
it's actually how you build the best health tech products, right? But it is very, very important that for me that I deliver care outside.
Yeah. Okay, so when looking at some of these health tech, most times they are far away from the hospitals. That is another thing. So what's the disconnect? What's the major disconnect between this technology and the users? What's the major disconnect?
For me, I believe is the fact that a lot of these devices or a lot of these apps, let's say, are built outside the knowledge of clinicians. They are built in a boardroom or they are built with just engineers, right? So if you are to build a health tech product right now as a product manager, if you have a good product manager on your team that is not even a clinician, they would always advise that you build alongside clinicians because at the end of the day, you end up seeing products that are very far from the reality of what the current healthcare system in Africa is facing. To be very honest, you have tools that require high maintenance, steady day to day, high connectivity to the internet, tools that cannot work without electricity. And to be very honest, it is far from the reality of what's happening. So I believe if we can start from the bedside and not the backlog, right, a lot of these gaps, right, would be filled and technology would actually deliver the care and the impact that it's supposed to deliver to patients and to the clinicians at large.
That interesting part is, as you're speaking like a professional. And those
What
of
she
us that,
is?
wait the heck on. So those of us that are talking to, many of us have not even gone beyond the regular health services that
Yeah.
we're asking. Now you're taking us to a higher scale. And I'm thinking, okay, are we going to measure up in some kind of way? Because look, many of us just want our traditional vitals to be checked, right? Or we just want maybe blood transfusion, for example. Oh, you just take a needle and then you take the blood. Now you are telling us there are different ways to do it. I say we are not even conquered the first one. We are not even saying that one is not even enough. And now we are going technology. How did you guys even plan that out? Because you need to get feedback from the patients, as it were.
Yeah, that's true. So, if we want to go to like the basic things, right? For example, in terms of vitals, right? There are already tools that you could use to record your vital signs. and they're already electronic. That's still tech. But that's like hardware because I'm more of a software
Person, okay.
technology expert. But that's hardware, right? You have BP machines that check your BP. That's still
Vitals, yes.
technology, right? Without having to use the manual mercury
Pump.
sphygmomanometer or the other
Yes.
manual one. Okay, so you can actually check your BP. You can check your pulse rate. There's a pulse oximeter. I think a lot of hospitals now are even going digital, right? A lot of hospitals now, they don't come and pump, pump, pump. They just put the machines on you and connect buttons here and there, and you are getting your results like you're seeing it. So these are things that you can also do from the comfort of your home without having to pass through the stress of going to the hospital. So tech is, I feel like one of the beauty of like healthcare technology is the ability to remove this fragmentation. So you can show your doctor that, oh, in the last 1 week, this is what my healthcare record looks like. This is what I've been able to check. I checked my BP on so and so date at so and so time. This is what it read. And then they'll be able, it makes the work easier. It
Easier.
makes them have like actual, proper context of what you face, what your reality is, instead of having to guess. And then there are sometimes that you yourself, you may even forget that, oh, I did this, I did that. So that
A
is
good positive. There's a
one of
positive,
the
yes. Nah.
positivities that comes with healthcare technology.
Okay. So I like the fact that you talked about removing those fragmentation. Now, many people are used to the traditional way of checking their BP. Many people are used to the traditional way of blood transfusion and all that. So when you're talking to someone that there is a health tech where you don't need to go to see the doctor, or they just have to plug some wires to your body and some buttons will be pressed, trust issues will start coming in. Someone who doesn't have the knowledge of tech will start telling you, how much should this thing? So how can health tech help to restore dignity, trust, and when it comes to anything clinical, can we use it to restore those trust?
Okay, when it comes to trust, right, and the ability to be able to ensure that this product is adaptable, I think a lot of health tech products needs to move from just storytelling, right? From just like come and buy me, I do this, I do that, to actually proper storytelling and proper documentation of outcomes. Why do I say this? If Mama Nkechi in the market tells you that my pikin buy this medicine for me or buy this thing for me, this machine, and the machine help me check my BP, mouth to mouth marketing, the person next to them that is always having to trek maybe a kilometer or maybe having to always enter bike to go to the nearest chemist or to go to the nearest pharmacy to go and check their BP. Will go and tell their son that Mama Nkechi say I pikin buy this thing for her. She abeg buy my own for me. So me, I no go dey pass through the stress. So I think what towards marketing also builds trust in the health tech space. I also believe that another thing to consider too is a lot of these digital products are not made from the mindset of Africans have low resources, right? So a lot of them would need redefinement. That's why things like some apps, all these Apple Watches and all of those things actually help because they are not so expensive, but at the same time they can be able to give you like quality care until it is required that you are referred to a human doctor, a human nurse, or a human therapist, depending on what exactly you need.
I want to look for your trouble a bit. Truly, yeah. In urban centers, healthcare system is better. I wouldn't say it is there 100%, but it's better compared to the rural areas. The thing is expensive. Like, how many people use smartwatches in rural areas to be able to track their
knowledge of it?
You don't even know what it is in the first place. But we understand that tech is coming here to help things be easier, track, keep data, keep your records. But the knowledge gap is also there. How are you bridging that part?
For a minute, you said the knowledge gap is also there.
Yeah, that knowledge gap is already a hindrance as it is.
Yeah, that's the thing about tech, right? It's not just enough to build a product, right? You have to build with your end users in mind. That's where human-centered design comes in, right? So if you are building a product and you are building alongside a community. This community knows that, oh, this product is coming to us, so this is what the product is supposed to do. This is how we are going to, this is how the product will work. I think if you know your target audience, you know what your target market is,
Okay.
what their needs are. If you are building for an urban market, you know that okay, you don't have to go too deep into looking for the best, cheapest option that can actually provide the same solution, right, to the problem. If you're looking at like a primary healthcare center, for example, now, right, you're looking at the fact that most of these people don't have smartphones. So that's
Yeah.
why tech comes in, right? And there's still options of USSD. There's still the option of IVR where you can just dial a code and somebody tells you, okay, if it's this one, press one, if it's the other one, press two. So there are actually other options, like there are cheaper options. Tech tech is made for everybody, right? So if you cannot afford the expensive
A, you
ones,
avoid B.
there
Okay.
are cheaper options out there that can provide the same solution. At the end of the day, every CEO, every tech tycoon is building with their product users in mind.
Yeah.
So if we are building with the African user in mind, you have to consider the fact that there's limited funding. The hospital is rationing hand gloves and nose masks. They're not the ones that would come and buy 1 million naira equipment that requires steady running of
Yeah.
electricity and
Yes.
owning of exactly. So if you build with your
End
end user
user
in
in
mind,
mind.
you're able
Yes.
to, yeah, exactly. If you build with your clinicians in mind, you build with your patients in mind or your caregivers in mind, I'm sure that there are ways of using technology in a way that is not so expensive, but it's also doing the job it's supposed to the best way
Exactly.
it can.
Okay, I have to look for your trouble again. So some of these texts are not done by people who are going to use it. I'm not talking end users now, who are the consumers. All of them are consumers.
The
Let me say
medical
it.
teams.
The medical team, and I mean, they are not the ones making some of this tech. How do you also get them to embrace it?
That's the issue. That's the problem. A lot of these things are they sit down in the boardroom and they make them and then they bring it to them at the end of the day, which is the wrong way to go about it. Because then it's harder to gain trust, it's harder to gain adaptation. And then what happens when you produce something that the market cannot afford? So I think a lot of healthcare CEOs, right, people that are into the health tech space, innovators, the product designers, and all of that, should start building products with the end
Both the
users,
users and
not
the yeah.
after you done. Yeah, both the clinicians should be. You should have a clinical person on your team. You should have someone in the legal aspect on your team. Because of ethical dilemma and all of those things. You should make sure that your engineers are people that they're not just after profits. They're actually after impact. Because at the end of the day, healthcare products is not like other products that, okay, let's say for example the fintech products now, where if you send money, your money don't lose, the money don't go, right? But for healthcare, you lose a life.
Yeah. It's not money, it's
Yes,
life.
so you need to build with, yeah, you need to build with the fact that clinicians have to be with you from day one. You cannot be building an EHR system and you've never gone to any hospital to find out, okay, how do you people currently do your records? Okay, what should the user flow of the EHR system look like?
Wow.
You can't be building EHR system and all the colors are the same. Both the one that is the vital signs are high and then the vital signs are low. Then the ones that the vital signs are normal. Like colors, because at the end of the day, nations are under tension. They're under a lot of pressure, right? You can't be expecting them to be using their brain. Your technology is stressing them. The patient is stressing them. So your tech solution should be easing their burden, not
Not adding to
adding
it.
to it. And
Bless you.
you cannot properly do that without them in the building phase of your product.
Okay, just share one technology that you have come across and it worked. Just one. Tell us what it does. Because look, some of these things look like so much theory and people don't even understand what it is. Just share one. How about the BPO? No, we'll talk about BPO plenty enough. Share another one.
Yeah, the SaaS industry, right? That's software as a product. So I think there's this app I used and somebody used around me in the hospital during my time at the Federal Psychiatric Neuropsychiatric Hospital, right? The name of the app is Our Paddy. So what this app enabled us to do was that it helped one of our patients. Let's call him Tunde, for example. Now, Tunde was a 19-year-old that was struggling with pressure from school, pressure from parents, pressure to make it in life. And you know the way the community is now is that if you are not a billionaire, you probably don't deserve love. So he was also struggling with relationship stress too. So
At
what
19.
our party was able,
Happy.
actually one of my
Happy. At 19, I don't see life. Oh.
uh,
Okay, go on.
what our party was able to help us do was that they have this AROC system, right? A predictive model. So through the communicate through his communications with the AI, we're able
Yes.
to know that, oh, this is a high risk person. This person is getting suicidal, right? And technology was able to help us do early detection. At the same
Wow.
time, it removes that stigma of having to go to the hospital, right? And then I'm very sure most of us don't even know what to do with mental cases. Like when there's a
Yeah.
mental issue,
When you mentioned
the first
psychiatric, I
thing
was
is
like,
where
okay,
to go
she went to Yaba left. Okay.
Sure, exactly. So there's already this stigma, but technology has been able to make it that, our party has been able to make it that you can actually have access to care, right? You can actually have therapies at your comfort. You don't have to go anywhere, just at your home there. Nobody knows that you have an issue. Nobody is stigmatizing you. There's early detection before the case becomes something that is not reversible, right? So I believe that a lot of products are out there too, like this, that are actually doing the work, and they are making healthcare outcomes way better because they are providing early detection, they are providing that, and they are removing that stigma, and they are still making it way more accessible in the sense that you don't have to queue. The last time I was in the hospital as a patient, I almost cried
See, hey.
because because I had to. I think I did not see the doctor that same day. I had to go home, and they continued with the number of the previous day. So if you have like AI triage systems now that you can just be this, that. I'm feeling nauseous, I'm feeling fever, I'm feeling this. And it's like, okay, based on your symptoms, these are some things that
You
could be
can
wrong.
try. Yeah.
But contact this person, and it gives you the direct number to a healthcare personnel. You save transport, you save
Yes.
time,
Yeah.
you save energy.
Yeah.
So you can see that healthcare has actually, the integration
Is
of
it not?
technology into healthcare has done more harm than good.
Yeah.
Done more good
Yeah.
than harm. Sorry.
Okay. All right. So I want to ask. I love the fact that technology, health tech is doing very well right now. But how do we protect patients' privacy when it comes with the kind of or with the amount of data that we have to put out for us to be able to use this technology?
Yeah.
How are patients' privacy
Protected.
protected?
Okay, to answer that question, I would say ethics, right? When you are building a product in the healthcare space, you should build with the fact that clinicians are in your team, lawyers and legal teams with compliance team, all those personnel should be on your team. Then your technical team and your marketing team. So if all of these can be able to work in sync, right, you would see that both privacy of the patient safety, and all of that is properly taken care of. Why am I saying this? Okay, let's take for example our party again, right? They have you know how sensitive mental health is, in the sense that people don't want their names out there, they don't want their pictures, right? So apps like our party helps people in the way that you don't log in with your name, you log in with a nickname.
Okay.
So I could be Dorothy and I'm logging in with like Chief or something, just something random, right? But in the system, you are a user. They can see that this user is a high level user. So you don't see that, okay, you don't have to log in with your pictures, right? Most healthcare apps, they don't require your name, just an email address and an avatar of your choice. So they don't take like personal, like information to the point that they are taking your face, your biometrics. You understand?
Yeah.
So it's now left for you to now share if you want to get in contact with a doctor. That's when the whole consent thing comes in. At the end of the day, if you give your consent, right, then they can help you better, to be very honest. But if you are not yet there, your privacy and anonymity is very key. And most health tech products already take that into consideration.
Okay. All right. Thank you. So for that is for the patients and the some of the doctors, right? Or
Some of
let's
the
say some
doctors.
of the team
Just
members.
the team.
But at what point should they draw the ethical lines? I mean, I'm talking about practitioners now. At what point should they draw the ethical line that you must not go beyond this point in giving out certain information about
Your
a patient
patient.
in using those technologies?
I think where you draw the line is where it's going to cause patients harm or where the patients did not give their consent, to be very honest.
Mm.
Let's start with consent and then harm. Because if the patient gives their consent and you as a clinician know that despite the fact that this patient has given their consent, it will cause them harm. It is your job to protect the life of your patient. Make them understand. Of course, you can't force them, right? Because at the end of
Yes.
the day, patients' rights exist. But it is your job to be like, okay, this product, these are the gaps I see here, this, that. I would advise, right, that you limit the way you use this particular product because it's causing you harm. So it's consent, it boils down to consent and does it harm a life at the end of the day?
Yeah.
Wow, that's
I
good.
mean, I appreciate the fact that there are young people who are enthusiastic about innovations happening because you're obviously a young person, and it shows that the future for the African continent in terms of healthcare is in safer hands because you are looking at newer ways to innovate.
Yes.
But then again, these innovations, does it cut across African countries? Because look, the truth is, this is just Africa. We're trying to promote everything that is happening
In
here.
Africa,
And
yeah.
your experience has shown that, well, at least we're getting it right here in Nigeria. But have you been able to check if these innovations cut across African countries?
Actually, I think our paddy, for example, we've been able to get, I think majority of our users are even South Africans,
Oh, okay.
right?
Okay.
So we have users in South Africa, Mozambique, Egypt, Kenya. So yes, it has actually across Africa. To be very
How
honest,
about cities as
I
well?
think, yeah,
Like urban centers and rural areas. Does that demography also
yes.
cover? Okay, okay.
Well, not to a large extent regarding the rural area, right? Because I mean, they still have limitations in terms of like how well they can use tech. They don't even
Okay.
have phones, you understand? But at the end of the day, a large part of the urban area has been covered to a very great extent in terms of healthcare technology. Nigeria is not even the number one right now, to be very honest. I think it's Kenya or South Africa. One of those countries are currently topping the health tech industry when it comes to health
Okay.
tech in Africa. Yeah.
So some of these conversations, do you guys take it to the grassroots? For example, maybe to the schools, so that you can meet the younger kids
Yeah.
there. Do you take these conversations to them?
Yes, definitely. I think during my work with Friend and Power, right, we were able to organize students campaigns and cohorts, right, to be able to help
Okay.
students become more aware of like mental health issues and how to detect them, how to use the app to be able to
Yeah.
call for help without the whole stigma associated with it. So I believe that yes, very, very much yes.
Okay.
There's a
Okay.
lot of yeah, there's a lot
Okay.
of grassroots movement already at
Yeah,
the moment.
that's great. That's
All
great.
right. Thank you so much, Dorothy. We appreciate your time. But I want to ask, what is your favorite African dish?
Let's see.
That's
I
set
think it
your.
could be between ogbono and or egusi. But I think I prefer ogbono with okra that they put okra inside. It's plenty food stuff.
Eh.
With which of the swallow?
I said food stuff like all those blockades.
Yeah,
I
yeah, all
mean,
those
swallow.
accidents, that usually happen. Yeah,
Is it with
obstacles.
eba, with
Yeah, like
fufu, with tuwo?
pounded yam. With
Pounded,
pounded
yeah.
yam.
Okay, I give it to
Let's
you.
Yes,
go.
I'm not done. And what part you are Nigerian, yes, but what part of the country are you from?
Okay, I'm from Kogi State, Ibira tribe to be precise.
Wow.
Okay, all right. So you have to greet our viewers in your Kogi language. You speak your dialect and tell them to keep watching Just Africa on SOUQ News TV.
Set off! Set off!
They can't set up for.
Oh, this is Just Africa. This is Just Africa. Come on. Why can't we just speak our African dialect? We should, right? So come on, do it. Let's go. We're listening.
Well, I agree that we should. Yeah, nah. I think I only know greetings like good morning, good afternoon. So I'm just going to say au revoir, and au revoir is good evening. Then I don't know the remaining parts, but please, you guys should keep listening. This is Just Africa. Can I speak to you?
Yeah, that works too.
Okay, au revoir. Make una continue to dey lis ten to Just Africa, right? Very help.
All right, thank you very much. We appreciate you. We appreciate that.
I do like the optimism and, of course, the potential that the continent has, and it is heartwarming to see that it's a conversation that is going even on a grassroots, because it shows that we are thinking about scalability and sustainability in terms of this. But I do hope that more of these kind of conversations happen beyond here.
Yes.
So that at least from the small corners that we've started, we've lit the fire, let the fire continue to burn until it gets to where it's going to.
And Dorothy did a whole lot of justice to this topic. She cited a very good example, the paddy, paddy.
Yes.
Just let people have the knowledge that we really don't have to travel miles to get to the hospital.
Healthcare services.
You understand? So the more we accept these things, the better or the easier life becomes. Of course, that's the purpose of technology.
Yeah.
So if we have technology in our tech sector and things are getting easier for us, why don't we embrace it? Make life easier.
You're so right. Today's discussion and conversation reinforces a vital truth that Africa's healthcare challenges cannot be solved by technology alone. But of course, Dorothy's work shows that real impact happens when digital health solutions are grounded in empathy, clinical realities, and of course, deep respect for patients and healthcare workers alike. Thank you so much for being a part of today's episode of the show. We cannot do this without mentioning that one of our two actually, although the stories, the announcements are of two opposite sides, but I'm going to still say it. One of our very dearest listeners, Barrister John Olori Toby, his wife just put to bed a beautiful, just about bouncing baby Jesus, just a beautiful princess early this morning, and the news came to us. We're all excited. For all of us here from the Just Africa crew, we are excited for you, and of course, we're praying that the child's birth will bring us more blessings. For you
a special shout out to the wife because she is an ardent follower. She's an ardent follower of Just Africa. Yeah, she's a super fan. I love you, madam. Congratulations to you.
And of course, the other one is a sad one, but then again, it came one of our ardent viewers as well. He lost his father today. The funeral. Ebenezer Fashiru, he lost his father, Oluranti Fashiru as well. But we're using this also to commiserate with the families. But anyway, it's Just Africa. We will spotlight everything as it's going. But thank you all so much for being a part of today's episode of the show. And do join us again tomorrow, where we're bringing another interesting conversation. Do not forget to follow us on all our social media platforms at SOUQ News Television, and do well to subscribe to our YouTube channel at Just Africa Show. Until tomorrow, stay blessed.